Welcome everyone. Thank you for joining us today for this webinar entitled COVID-19 Strategic Health Purchasing and Resource Mobilization in Africa. We really appreciate you joining us at such times. A shout out to our member countries, participants of various programs, and our partners. I see a lot of familiar names on the list of participants, and that's always really nice. My name is Ashvina. I'm head of technical at the Collaborative Africa Budget Reform Initiative, also known as CABRI. Before we dive into the subject matter, let me remind our viewers of a couple of housekeeping rules. This webinar is being translated in French, so I will say a few words before switching back into English. Bienvenue à tous à ce webinaire par CABRI qui s'intitule le COVID-19. Achat stratégique de santé et mobilisation de ressources en Afrique. Pour ceux qui souhaitent poursuivre le webinaire en français, veuillez cliquer sur le bouton au bas de votre écran qui s'appelle Traduction et ensuite Français. Donc, je vous donne quelques secondes pour faire cela. While our French viewers enable the translation tool, let me remind participants that your video and audio have been turned off for the event. Do feel free, however, to interact with each other in the chat box. And of course, do submit us questions in the Q&A box and do mention to whom the question is addressed so that it's easier for me to channel the questions to our panelists. You will also see that there is a voting item for the questions. So do vote for the questions that you want to be addressed in priority. This webinar is being recorded for our own viewing later on and for dissemination. And finally, do feel free to tweet and relay on social media. So without further ado, I now have the pleasure to introduce our esteemed panelists today. Neil Cole is the Executive Secretary of CABRI. He has more than 20 years experience in public finance and budgeting. As a senior manager at the National Treasury of South Africa, he managed the national budget process and contributed to the design and implementation of several public finance management reforms. Neil represented South Africa at several high levels forum on aid effectiveness and served as co-chair of the Effective Institutions platform. Neil has led CABRI from its formative years as an informal network to its current status as a Pan-African organization whose work covers more than 30 African countries. Our second panelist is the head of policy, health, diplomacy and communication at Africa CDC, Dr. Benjamin Djoudalbaye. Welcome. Prior to joining Africa CDC, he was a senior health officer for infectious diseases at the African Union Commission for more than 8 years. He has a strong professional experience in strategic planning, public health programs, and operational research in Africa. Dr. Djoudalbaye also has a very intense knowledge of coordination mechanisms, including advocacy and resource mobilization, multilateral and bilateral cooperation, public and private sector. He, among many degrees, holds a Doctor of Medicine degree, a Master degree in Population Studies and Public Health, and specialized training from the Université Claude Bernard Lyon 1 et Paris 7. Our last two speakers will give us an insight of what's happening in their country. So the third speaker, Professor Kelly Moa-Kingsley, is currently head of finance operations of the state in the Ministry of Cameroon, in the Ministry of Finance in Cameroon. In addition, he's project finance manager with the Ministry of Economy, Planning, and Regional Development. Prior to the ministry, Dr. Kelly served as manager in the Directorate General of Treasury, Monetary and Finance Corporation. He served also as the resident representative operations with the UN and consultant to the African Development Bank. He is an adjunct visiting lecturer with several institutions and a published author and researcher with over 35 peer-reviewed articles. And last but not least, Mrs. Evelyn Abena author is a public financial management expert with over 20 years experience in budget planning, financial management, and revenue mobilization. She was appointed Director of Budget at the Ministry of Finance in Ghana last year, Until her appointment, she was the head budget planning and preparation unit of the budget division of the ministry. She's played an instrumental role in reforms in the budget division. Mrs. Arthur is an alumnus of the Kwame Nkrumah University of Science and Technology, where she obtained a Bachelor of Arts degree in Social Sciences. She also has an MA in Development Studies from the Institute of Social Studies in the Netherlands. So a very esteemed panel. I'm very much looking forward to the conversation with all of you, and thank you for being with us today. So Neil, as of the latest report, there are more than 35,000 cases reported in Africa out of the 3 million cases globally. And cases are growing exponentially in Africa. The World Health Organization yesterday expressed concern that there has been a growth of 42% in the number of cases in Africa, with 24% increase in the number of deaths. What can you tell us about the way African ministries of finance have responded so far to the COVID-19?
Thank you very much, Ashvina. Just to say that I believe there is a slight technical issue with the translations, so maybe you can have a quick look at that. But I will proceed. So also just on behalf of CABRI, thank you to all the panelists and also to all the participants that have joined this second webinar in a series of webinars covering this topic of COVID-19 financing responses from governments. And I do hope that all of you that are in lockdown or where you have restricted movement, that you are keeping well. Some very common headlines that we are seeing around at this time have been that low middle income countries, even middle income countries, are going to require hard currency, and these are for the scaling up of health responses. So we are seeing many countries allocating increased budgets to health expenditure. But it's also been in the headlines about how countries find the cash to make transfers to those that are now unable to work, out of a job, and also thinking about those that have entered these situations of lockdown already, not earning an income. So many countries thinking about these massive feeding schemes that have to be undertaken. And personally, a surprising headline for me was, I suppose one can call it extraordinary advice from the IMF, not the kind of advice that you would commonly expect to come from the IMF, and that is spend what you can to fight COVID-19, being told by the IMF to their member countries. This obviously implies that there is either an existing fiscal space that countries have to undertake that massive additional spending, or rightfully or wrongly, that this advice to an extent throws issues of sustainability or sustainability considerations out of the window. And maybe this is something that participants can also consider here, is in this advice to countries to spend whatever is required to fight COVID-19, which in some cases, in many cases, I suppose, are going to involve fairly substantive borrowing, whether that does result in throwing some fiscal sustainability issues out of the window. We see several countries have reprioritized. So the list there that we've picked up is Angola, Zambia, Mozambique, Senegal, Zimbabwe, Nigeria, South Africa, and we'll go into a bit of detail on the extent of that reprioritization, which I suppose is one of the key components when thinking about what fiscal space do countries have. One of the main components being reprioritization, or otherwise called just a reallocation of the budget. A few countries have turned to their contingency reserve or those that make provision for national disaster funds, Ghana, Seychelles, Zimbabwe, and Nigeria. But in many cases, these have proven to be insufficient, and countries have had to look at a combination of reprioritization as well as contingency reserve, but also, and I think very importantly now, is to look at what facilities are available and have been made available by the IMF, African Development Bank, the World Bank, and also a new player, being the BRICS Bank that certain countries have approached. Some of the innovative financing that countries have looked at include the setting up of trust funds or solidarity funds. During the Ebola crisis in 2014, Liberia set up a trust fund into which development partners, private individuals, the private sector, and government could put funds. And the solidarity fund that South Africa has set up is essentially very similar to that, managed independently with a board and other mechanisms put in place to ensure that the funds are spent for the intended purpose. So just some of the specifics. Angola has undertaken fairly significant reallocation of their budget that involved cutting 30% of expenditure on goods and services. All of CapEx has been suspended, and they've made an additional $40 million to health spending. Mozambique, additional spending on health. So what we are seeing is that the health budgets of many countries are changing very significantly. And this is important, and it is ultimately about saving lives. Similar case in Gambia, Senegal has brought about fairly substantive changes across their budget. They've cut operating expenditure, they've deferred some investments, and an amount of $107 that has been allocated as expenditure just on COVID-19. And then also in the case of Zimbabwe. And now I want to do some advertising, and it's where we are gathering all of this information. And this is a very recent facility that CABRI has established, and that is a COVID-19 Public Finance Response Monitor. And it is a collection of data on the responses that governments have undertaken in respect of budgets and also financing. So it looks at the extent of reprioritization that has been undertaken, the measures or changes to the way that goods and services in health has been changed and accelerated, and also new ways in which funds have been released. Looks at what are some of those economic measures that countries have made in these purchases, how they've gone about mobilizing resources and the sources of those funds, and then also and what this webinar wants to focus on, what are some of the strategic healthcare purchases that governments have undertaken. So I would advise all of you to have a look at the monitor. It is, I think, in these times when we are not meeting in person for peer exchanges. The monitor provides a good tool to understand what some of the other peers in Africa are doing. So let's look at some of the ways in which governments have gone about accelerating procurement and streamlining procedures, and the other speakers will go into this in greater detail, broadly speaking, and then also looking at their specific country experiences. The emergency clearance and simplified licensing, we've seen that in the DRC and Mozambique. Most countries have enacted or put into effect the emergency procurement provisions that already exist within their public finance management regulations and laws. We've seen that in Botswana, Mozambique, South Africa, and Zimbabwe. And these emergency procurement processes are important because they set out how things can be done more streamlined, how things can be done quicker, how do you get things like personal protective equipment, how more quickly do you get and purchase ventilators, but staying within what is set out as emergency provisions within sometimes often existing regulations and laws. We've seen countries utilizing digital platforms such as Cameroon and Benin. And then obviously, very importantly, whilst these emergency provisions are in place, while officials are having to work from home or coming into the office under restricted conditions, there's also the need to ensure that your normal treasury functions continue. So how do you keep your integrated financial management system going? How do you continue to make payments? How do you continue to pay salaries, etc.? So yeah, just looking at some more specific examples. So Mozambique has exempted customs duties and miscellaneous taxes on imports of medicines, reagents, and also COVID-19 materials. South Africa, the finance minister has issued what is called a conditional exemption notice, and this is under existing legislation, the Public Finance Management Act, and then the Municipal Finance Management Act. And this is really about ensuring that efficient service delivery happens and that you eliminate delays, right? I mean, this is about being able to get the N95 mask to hospitals when they are needed. But also just to emphasize that that measures have been put in place by governments to ensure that your normal treasury functions are still continuing in an environment where a lot of officials are working remotely. Pricing is obviously a big issue here because as the demand ramps up, as the critical equipment that is required for treatment goes into shortage, that suppliers are going to look at how they can make an extra buck. And we've certainly seen this worrying occurrence of price hikes across many countries. I mean, it's just been recent cases in South Africa where a company that provides masks has increased the price of masks, and there was a ruling against that company that resulted in a fairly huge fine. Some other countries have controlled prices through subsidizing medicines and personal protective equipment, such as Benin. Angola, Ghana, Mozambique, South Africa are regulating prices, as explained in the example. So where prices have been hiked, a company can face quite significant fines. And then several countries have introduced reduction or exemption of duties on imports of medicines and medical equipment, and that has resulted in a lowering of prices. And when thinking about strategic purchasing, price is obviously a very important consideration. So what is strategic healthcare? And I say this is really just a very broad definition that the following three speakers will go into a greater detail. I mean, it is essentially about what the purchaser will buy. So what type of benefit packages, medicines or diagnostic services are going to be purchased or offered. Who will provide those services to the patients? Is the purchase going to be for primary care or more specialized services? And then also in many of our countries where we do have quite large private providers of health, the question around strategic purchases is also about whether it is public or private. And then, how the services and medicines will be purchased. Will providers be contracted? Are there existing service level agreements that are in place? And that often results in a faster procurement process. And then what are the provider payment methods and the rates that are applied? So these are the various questions that are asked when one is taking a strategic purchasing decision. What we have found, which seems to be a quite unique to Africa, are several, well, maybe not several, but we have found regional initiatives, such as the SADC initiative that was established under the National Emergency Operations Center. And this is essentially to facilitate the coordination of logistics and stockpiling for disasters at a national level. There's a degree of pooling of procurement services, and hopefully that contributes towards economy measures and also efficiency measures in the purchase of pharmaceuticals and other medical supplies. So that is, I think, an important development, especially for low middle income countries and middle income countries within the SADC region, to take more strategic decisions when it comes to the purchasing. And then, I mean, we're very fortunate to have with us the next speaker. Maybe this is a segue into the next speaker, is someone from the African Center for Disease Control and Prevention, Dr. Benjamin Djoudalbaye, who will be our next speaker. So thank you, Ajvina. That's all from me. And as I'd like to conclude in these webinars is, for those in lockdown, stay indoors as far as you can. Wash hands, keep your distance, and everyone keep safe until such time that we are able to meet again in person. Thank you, Ajvina.
Thank you very much, Neil. Indeed, those are always good reminders for every one of us. It was a really great overview in terms of what are the different measures that have been taken by the ministries of finance and governments across Africa. Before we move to Dr. Djoudalbaye, let me remind participants that you've got translation facilities of English and French. And if you click on the button that's at the bottom of your screen that says interpretation or interprétation, it will give you the ability to choose whether you want to listen to the webinar in English or in French. So Dr. Djoudalbaye, those implementation of policies are really great, but there are still so many challenges. And only last week, the World Health Organization has launched the ACT Accelerator to call for, among other things, mass mobilization of the international community an organization to rally around one cause, fighting the COVID-19. But what can you tell us about how the CDC Africa is stepping up to this role, and what are the measures that are being implemented?
Thank you so much. Thank you, Abena, for associating me to this webinar. It is a pleasure to be here and to share with you the continental experience and the continental perspective on COVID-19. So I have a couple of slides. Can you bring them up so that I can go through? Thank you. Yes. Okay. Okay, you want me to go through like this, or all right. So next slide, please. Next slide. The slides are not showing here.
I think there's a slight lag. So let me just try that again.
Okay. Yes, this is the numbers, but it has not been updated. But in terms of cumulative case fertility rate in Africa, it is about 4.4 on the continent. Next slide. These are the top 5 countries in Africa reporting many cases. We have South Africa, followed by Egypt, Morocco, Algeria, and Cameroon. Slide. Okay, this is the map of the COVID epidemic by phase on the continent. We have today 38 countries in phase 2 and 11 countries in phase 3, and still in phase 0 we have 3 countries, Western Sahara, Lesotho, and Comoros. Next. This is the Africa CDC strategy to tackle the COVID. This strategy has been endorsed by the Ministers of Health early in February this year, and the ministers adopted the strategy, and also they set up the task force to tackle the coronavirus on the continent. So the strategy will do 3 things: preventing transmission, preventing death, and preventing harm. And the total estimated budget for this strategy is about 440 million. And this is not the budget for the member states. This is the budget for the Secretariat here to address the COVID epidemic on the continent. Next slide. I mentioned briefly the task force. So this is how it looks like. It goes from the head of state and government down to the technical expert on the continent. Can you click on the slide 2 or 3 times? Again? 1 more? Yes. Okay. Yeah. So we have at the highest level the Bureau of the Head of State and the Government, led by His Excellency President Cyril Ramaphosa of South Africa. And this committee of the Head of State have established 3 subcommittees. 1 committee on finance, 1 on transport and logistics, another committee on health. So on finance, it is to ensure the resource mobilization for the COVID response. And you heard what the ministers of finance are doing on the continent from the previous presenter. And in terms of logistics and transport, it's to open up transportation and logistic channel for the key supply, and to allow also the deployment of the rapid responders on the continent. The Ministers of Health, of course, will implement and promote the adoption of public health response strategy. Now, under the head of state and government, we have also the Continental Steering Committee, which oversees the work of the task force. The task force has 7 technical working groups, one working group on surveillance, one working group on clinical management, another working group on infection prevention and control. We have another one on supply chain and stockpiles, laboratory, diagnostic and subtyping, risk communications, and the last one that has been added recently is on science standards and regulations. And the task force will provide the thought leadership on key technical public health response areas. And the same is being implemented at the regional level by the different regional economic communities. And Africa CDC also has 5 regional collaborating centers supporting the regional economic communities to implement that strategy. So it goes down, up to from the head of state down to the technical experts. Next. These are the key achievements from the technical working group to date. Well, in terms of surveillance, we have trained countries, 23 countries in enhanced point of entry surveillance and event-based surveillance. We have also developed Africa-specific guidance on contact tracing, physical distancing, and meetings and travels. We have also developed, we are developing daily updates on the epidemiological data, and that one, we have a dashboard, a live dashboard on the Africa CDC website. It's Africa CDC in one word.org. When you go there, you will have a landing page on COVID-19, and we have a dashboard there with all the information and all the materials that we have developed are also uploaded there. In terms of supply chain, you all heard that the Jack Ma Foundation has donated to African countries supplies, and we were supporting the distribution of these supplies across the continent. What we have done is to establish a hub, a cargo hub here in Addis Ababa, and the humanitarian air supply to the member states with Ethiopian Airlines in collaboration with World Food Program. And we have successfully moved out 1.5 million laboratory tests and supplies to the member state. And we are using this hub to stockpile surveillance materials, PPEs, laboratory and medical supplies. In terms of laboratory diagnostic and subtyping, when WHO declared the COVID-19 has emergency public health event of international concern, we had only 2 countries on this continent that were able to diagnose COVID-19, South Africa and Senegal. So we have seen that vacuum and we move into that space quickly, and we increase the capacity of the countries up to 42. And we were able to distribute 78,000 of test kits to 42 member states. Of course, this is accompanied by the SOPs for testing and interpretation of results, specimen collections and transportation and biosafety. In terms of clinical management, we have also trained more than 1,000 clinicians. And to date, I think the number is about 3,000. In terms of infection prevention and control, we have also trained 39 countries on infection prevention and control, and we have developed Africa-specific guidance on quarantine. In risk communication, 26 countries have been also trained, and we have launched surveys to measure impact of physical distancing. And we have also developed a risk communication material on countries for COVID-19. We have also, in terms of science standards and regulation, developed, and we are refining the epidemiological estimates of the outbreak in Africa. And we are also developing analysis on impact of physical distancing measures on the case growth. Next slide. This is the game changer for us, the partnership for accelerated COVID testing. This initiative aims to ensure that at least 10 million tests are conducted in Africa in the next 4 months. And if you look at what is happening globally and the number of the tests that are being conducted in Africa is just very low. So that's why this initiative is to conduct 1 million tests in 1 month. And this initiative was launched last week. And we are continuing deploying the tests in the member state. And 10 million will be done in the next 4 months. We are also establishing Africa-wide pool procurement using the cargo hub that I just mentioned to you here, and establishing Africa-wide storage for distribution hubs. We are also deploying 1 million health workers for contact tracing to accompany this partnership, because if you don't have people to trace the contact of the positive cases, your effort will be vain. And also standardize and deploy new technologies for surveillance to help reopen economies quickly. Next slide. So this is just why we have launched the pact, is to scaling up the capacity in Africa. And if we just compare what is happening in the other regions of this world and what we are seeing here in Africa, we are learning the lesson from the other countries. Like South Korea ramp up the test capacity by 15,000 tests a day last February, following the massive numbers of cases in Daegu. And now the case growth is flat in South Korea. These are the good lessons, and this is why we want to expedite and increase or scale up the testing. Iceland also has tested 10% and plus of its people, and it has now 1,700 cases and only 9 deaths. What we don't want also, and what we have learned from this, is the lesson from Japan and from US. So these are not the good lessons, and we are drawing our experience from that one. Next. So the target for us is to dramatically accelerate the number of tests in Africa, and using the capacity that is existing on the continent. So today, we were only able to do something like 400,000 diagnostics, and we want to increase by 1 million after 4 weeks, and this is a 23-fold increase to 10 million quickly in 4 months. And by the end of this year, we are projected to increase to plus to 20 million tests. And based on the current capacity, Africa can conduct 20 million tests. But this number could increase if countries scale up testing equipment footprint. That is one of the limitations that we can see. Next. So the impact will scale up Africa COVID testing in 3 ways. One, in terms of test kit supply, the distribution of the initial supply to 42 member states that I mentioned, the numbers is 78,000 kits, and distribution of 1 million test kits from Jack Ma Foundation, and procurement of additional 1 million. We have already ordered 500,000 from Germany, and 500,000 is now available here in Addis Ababa. We have also set up an African-wide food procurement system that I mentioned. And also we are going to use the capability building the training of the member states on PCR diagnostics, the development of SOPs, and also the deployment of laboratory experts to provide targeted technical support. Sometime now we are conducting even virtually training sessions for lab technicians, and we have deployed the Africa CDC Genomic Institute. We have deployed the sequencers to 12 member states. So the training has started online. Also, we are going to use the private sector engagement to increase the testing. And the engagement with the private sector for alternative testing platform like that is widely available on the continent, and other, like if the serological tests are available, we are going to use that one. Next. So if no known delimited community transmission, anyone with fever and acute respiratory syndrome who have been in place in at least 14 days, COVID-19 is transmitting, and who is currently in location without local transmission. So all symptomatic contacts of a confirmed and probable case will be tested, and also all SARI cases will be also presenting to hospital, and where the presented circulation of COVID cases will be tested. Also, healthcare workers with symptoms will be tested. And if there is a widespread community transmission, we are going to test all the severe acute respiratory infections to hospitals, and also healthcare workers with symptoms consistent with COVID-19, regardless of the exposure. Next. So in terms of the tracing initiative, we are going to deploy and train community health workers to support member states on contact tracing, engaging with technology companies like telecom companies to support the deployment of the contact tracing technologies using the mobile apps, and also set up a surveillance data system at member states and in the emergency operating center by deploying technical experts. Next, I think this is my last slide. Thank you.
Thank you very much, Dr. Djoudalbaye, for this great overview of the different measures that are being undertaken by the CDC Africa. I think this is a good transition to looking at how countries are now implementing the different fundings that they are getting, but also it will give us the opportunity at a later stage during the Q&A sessions. And I take this opportunity to thank everyone for their great questions so far. Keep them coming, to talk about how do we actually bridge the funding to the people, and how do we intervene at different steps of the supply chain. So our next speaker is Dr. Kinsley from Cameroon. Dr. Kinsley, can you hear us? I know there has been a couple of connectivity issues. So the next presentation will be in French. Let me remind our viewers that there's an interpretation button at the bottom of your screen, and you can click on that and choose the language that you wish to listen to. Dr. Kingsley, are you able to hear us? I think we may be having a couple of issues with Dr. Kingsley. So maybe in the meantime, while our technical team try to help out the connection with Cameroon, maybe Evelyn, Arthur, could we move to your presentation, and could you share your experience of how the Ministry of Finance is tackling the COVID-19 in Ghana?
Okay, thank you very much, Spina. It's a pleasure to share the experiences of Ghana with the team, and I must say that I I'm very grateful for you, to you for inviting us to share our experiences with you. Let me get my presentation on the screen, and then I think trying to get my presentation on the screen, and then yeah, here we are. So by way of presentation outline, I want to give a brief introduction and then look at what our projected our projections were on the impact of COVID-19 on Ghana's economy, and so the steps that Ghana has taken to be able to address the pressures that arise from the COVID-19 pandemic. Of course, when the pandemic started, I'm sure that Ghana was not alone in thinking that it was something that was concentrated in China, and so, but then we knew that China was a trading partner and was very instrumental in the economy of Ghana, and so we needed to take steps to be able to resolve the issue. So we have started implementing our budget. Fortunately for us, Ghana this year went to the Eurobond market early enough, and so we're able to secure some funding from the Eurobond market to support our budget. And so as far as liquidity challenges were concerned, because of that effort that was taken very early in the year, we had some resources to be able to enable us to implement our budget. But notwithstanding that, once the pandemic started rolling out across the world, we knew that we needed to take some measures. One of the key things that we saw was that it was going to significantly impact on petroleum receipts, and crude oil prices had declined. And at the time we did the budget, we had estimated using $64 to a barrel, and because 63.4, so 60 to a barrel. And as at 23rd of April, the cost of crude oil had gone down to as low as 16.5 million. And so we knew that that was going to significantly impact our budget. If you look at the budget, capital expenditures, I mean, a lot of it was going to be funded from crude oil. And so once crude oil prices were affected, that it was going to significantly impact on our budget. And then again, Ghana also trades a lot with the outside world. And so the trade, the custom receipts also were going to be impacted significantly. And then there were also shortfalls in the tax revenues, non-tax revenues coming from sale of spectrum and capital gains that we had in our budget and thermal plans. And then we also knew that with the pandemic, we're going to have increased expenditures, especially in the health sector. I mean, we've heard from the other presenters that have come, the earlier presenters, that all of a sudden because of the pandemic, you have to make increased expenditures in health, and you have to procure large quantities of protective clothing for people in the health sector. And there are also some other health-related expenditures, which was not in the budget. We're also aware of tight financing conditions as a result of slowdown in economic activities. And then one of the areas that we also saw some disruptions were also in the impact that it was going to have in agriculture, and especially relating to disruptions in the supply chain, which could lead to slow growth in agriculture. I just want to run through those and then get on to them. The impact, the other area we also saw the impact was on trade and industry. As I said, we trade a lot with the outside world. There's both domestic and international. We had international trading partners, and that was going to be reduced as a result of the pandemic that we all know of. And we have already been seeing significant reductions in the trade volumes in Ghana with many countries, especially China. China continues to be one of China continues to be, no, wait, I just want to, I hear, I need to get all of you.
All right. Yeah, no.
Is it better now?
Yeah.
Sorry. So, in light of all the anticipated challenges that Ghana saw, we needed to immediately take steps, one, to make sure that we were protecting lives, and also to make sure that we manage the economy. One of the things, because of the increased expenditures that were anticipated on account of the pandemic, and we had to find money. So the first thing that we did was to look at areas where we could make, we'll find resources. And one of the areas that we looked at was to lower, we have in our Petroleum Revenue Management Act, there's a provision for Ghana to put some of the funds in the stabilization fund so that in the event that petroleum revenues decline, we can't fall on the stabilization fund. There's a section 23 of the Act allows the Minister for Finance to lower the cap on the stabilization fund and to be able to transfer the excess over the cap in periods where we have economic challenges into the contingency fund. So it was one of the first things that we did. We, Ministry of Finance did a proposal to Cabinet, Cabinet approved the proposal, and we sought parliamentary approval to enable us transfer, lower the cap first, because there's the Minister for Finance that sets the cap. So we sought approval to be able to lower the cap and then to transfer the excess over the cap into a contingency fund that will be used to support the increased expenditures in health as a result of the pandemic. We also, because we realized that oil revenues were going to decline, we needed funds to be able to support the budget to make up for the gap in financing the budget. So we quickly approached the IMF to assess funding from the Rapid Credit Facility to support the ongoing priority programs of government, and as well as to pay down some of our interest payments. We also have deferred payment on interest on some of our non-marketable instruments. We have also reprioritized our expenditures, to reduce some of the existing goods and services and capital expenditures to be able to make space to accommodate the increased expenditures as a result of COVID. We also approached the World Bank. I think when Neil did the presentation, he said that some of the country experiences have been other countries that have taken loans. So we also approached the World Bank to take some credit facility from the fast track credit facility from the World Bank to be able to support COVID funding, in addition to even realigning some existing agreements that we had with the World Bank for support for other projects to be able to realign those expenditures rather to health than to the existing programs. So that is those are some of the measures that Ghana has taken. we, as part of our fiscal consolidation process, Ghana had passed the fiscal responsibility law that enjoined us to keep a deficit target not be beyond 5% of our GDP. We are considering reviewing that because since the COVID pandemic is going to affect our trade volumes, it's also going to affect our receipts from our trade operations, and so we have had to review the fiscal responsibility rules. So it's something that has been considered, and we're likely to exceed the 5%. So we have made a statement. The Ministry of Finance has made that statement to Parliament, and so there's a likelihood, and it's very likely that we'll exceed the 5% because we're going to be financing our expenditures more than from borrowing, additional borrowing than from revenue. And so obviously our fiscal deficit is going to increase beyond the 5% that was in the Fiscal Responsibility Act. Another thing that we have also done as a country is to also set up a COVID National Trust Fund. I think that it was one of the examples that have been cited in the earlier presentations. The laws allow us to also set up a trust fund in which private individuals and the public can contribute funds to. And I must say that that is also yielding a lot of dividends for us. And it's chaired by the former Chief Justice, and so it has its own governing board, and that has been done to also enable us to mobilize some funds to fight the pandemic and to support the activities. We, as a result of lowering the cap and putting money in, then being able to transfer some funds from the excess over the stabilization fund into the contingency fund, we have a coronavirus alleviation program, which is to help us to address the disruption to economic activities, and also to ensure that we are able to minimize the hardships and to be able to rescue and revitalize industries. I think that we are also looking at the opportunities that can be, because if you look at a lot of our responses, we have turned to the local industries. I mean, a lot of facial mask and hospital protective equipment have been provided, have been produced by local industries. So one of the things was also to see how we support our local industries in those difficult moments. So our COVID response, our coronavirus alleviation program covers the following areas. Well, the first key area is support to households. I think there was a complete lockdown in the areas that were mostly affected in Accra and Tema area, and also in some parts of the Ashanti region, Kumasi. And so during the period of the lockdown, part of the response of government was to provide food packages and hot meals to at least 1 million people, the vulnerable groups in these areas that I've mentioned. We also provided some funding. We have a national buffer stock company. And so we also provide some funding to the national buffer stock company to be able to buy food and store food and then distribute the food so that we are able to ensure some food security. So the part of that funding from the contingency fund was also used to make sure that the buffer stock fully had sufficient funds to be able to go about the provisions. In the wake of the lockdown and also the impact that this has had generally on businesses, government took a decision to also absorb water bills of all Ghanaians by paying for 3 months by paying 3 months water bills of all Ghanaians, and also providing water tankers. So part of the coronavirus alleviation program and our resources from the contingency fund was supposed to support this thing. So we have been in touch with the water company, Ghana Water Company, to look at how that is done. And so some resources have been advanced to them to make sure that whilst people are at home, at least they have water. And then I think the main part was also to help businesses and the vulnerable groups. Then one other area that I think that we've also looked at is also how we are able to take care of the health workers, because this is a very crucial period for all of us. And there are people who are working around the clock to make sure that they take care of the people that have been quarantined, people that are sick and they are in hospitals. And so the government announced a waiver of personal income taxes for all workers. I mean, as a kind of motivation and encouragement for people in the health sector. And so that is something that has been done. It took effect for March. So for all health workers, because to encourage them, because they put their lives at risk to be able to take care of people who are sick. And so that has been done for all health workers. In addition to that, government is also providing some 50% basic salary for all front-line health workers for 4 months. So this, the tax waiver is for all health workers, irrespective of whether the 50% basic salary allowance is for all health workers, frontline workers. So those who are taking care, directly working with the patients, people who have been tested positive for coronavirus, and then those that have been hospitalized. So that is also to encourage them. Then there was also a decision to bust the health workers, because in the wake of the lockdown, vehicles were not moving, and it was challenging for health workers to move from their homes to. So government made an arrangement for the health workers to be bused to the hospitals and back to their residences, and that had to be paid for. And so that has also been, that was also what we are funding from the contingency fund that was created from lowering the cap on the stabilization fund, petroleum revenues. Government is also providing some resources to small and medium scale, because Ghana is, I think the informal sector dominates the economy. And because people are not able to go out and come in, and so government decided to also put in some money to provide soft loans to micro, small, and medium scale businesses. And so these loans, the beneficiaries of the loans will have a 1 to 2 year, 1 year moratorium, and then a 2 year repayment period. So these are not free money, but at least it's supposed to cushion them. And as I said, well, I think that we also want to take opportunity of those to also grow the domestic industries. If you look at our response, a lot of personal protective clothing equipment that, especially in terms of the scrubs that are worn by the hospitals, the face masks, some contracts were awarded to local people to make them, and they were able to supply quite a number of that for use. And so,
Evelyn, you have 2 more minutes.
2 more minutes. So let me just go through the implementation process. So we set up a COVID, Ministry of Finance itself, as part of it, set up a COVID response team. And the functions of the team was to ensure quick response to requests and to review and validate all the funds requests that come to us and to provide feedback and reports to management. And in guidelines for assessing that, we're making sure that our procurement systems work. The requests should be consistent with the emergency. There's a response plan that has been prepared by the Ministry of Health, and all the requests that comes to Ministry of Finance has to be consistent with the plan. We are also using the procurement and the PFM systems. Procurement law provides for emergency procurement processes such as sole sourcing, selective tendering. So we are using that to be able to that. So all requests comes through Ministry of Health, is vetted by them. The minister submits it to Ministry of Finance. Then there's a committee at Ministry of Finance that will also verify those ones before it's sent. We're using the internal audit units to scrutinize all payments before we make payments. On the World Bank ones, we're using the implementation arrangements under their financing agreements to ensure that we have a value for money. So in terms of, we set up a COVID account at Ministry of Finance, COVID-19 account. So the funds are transferred into the COVID-19 account. And as I said, everything comes through the Ministry of Health. And when it has to do with the service provider, we pay directly to the service provider, but it has to be vetted by the Ministry of Finance, but the payment is made directly. If there are collaborating agencies that also have to need some funding, it goes through Ministry of Health before it comes to the COVID accounting, the committee in Ministry of Finance, and then the money is drawn from the account to pay them. But as I said, we pay directly to the service providers. It's only the operational funds that go to the Ministry of Health to be able to undertake activities. Our challenges, I think that in the initial plan, we had focused on health-related expenditures, but I think that we're seeing that there are other sectors that also have emerging issues that are also related to COVID-19, the pandemic. And that has put pressure on us to release more funds. And I think that is a major challenge that we have. How do we, and as I think that the situation evolved, that might also put additional pressure on us. So I think the government is facilitating rapid response to the crisis. We're improving health personnel needs to prevent massive outbreaks and also to improve the economy. The interventions and measures to improve the business environment and provide the necessary support for citizens is to limit the impact. And then we think that the response so far is so good, but we also are looking at how, given that the numbers are increasing now, because Ghana, I think that our numbers are going up, we will review as we go along, and then also, if it becomes necessary, we'll continue to readjust our budgets to be able to accommodate more expenditures in this area. Thank you so much. Yeah, thank you.
Thank you so much, Evelyn. I think one of the key lessons from your presentation is that the COVID-19 goes beyond economic implications. It has impact on every sector of the population, also reach out to every aspect of the economy. So without any delay, because there are great questions that have been lined up and there are a lot of conversation going on, let me bring out one of the main issues that is threading in the chat box, and that has to do basically with supply chain and pooled procurement mechanism that you spoke about, Dr. Djoudalbaye. So maybe a question for all of you, but starting with Dr. Djoudalbaye, is in this new structure of pooled procurement mechanism, can you tell us a little bit more about how this will work in the concrete, and what is more specifically the role of the Ministry of Finance to make sure that they bridge the gap between the CDC Africa providing the medical supplies or the test kits, and the population?
Oh, thank you very much. There are two processes. The first process is to establish a cargo hub here in Addis Ababa, because most of the countries put travel ban, and they are receiving only some cargo flights. And even for cargo flights to go to the countries, they need additional authorizations to go. So it is even very difficult to move cargo flights to the countries. So this challenge is being overcome by the African Union effort. And today we have this cargo hub established. Parallel to that one is the procurement and the supply chain that is being established. It is still under establishment. And even yesterday when the head of state met, they say that we should expedite effort. So there are some groups, including the private sector, who are working together to put up a system, including using technology and all these devices to see how best Africa can get access to the international market. Because today everybody is going to buy to China, and individual countries cannot even access to the market today. They can go there with their money. They will say that you have to queue up, and we can only give you the supplies in the next 8 months. For instance, it's happening, and we are getting the feedback from the member state. So that is this process that is ongoing is both political and technical on the chain, the procurement chain. Now there is in terms of the ministers of finance is to make sure that the resources are available so that the countries can procure the needed medical devices that they require for the fight against COVID. Over.
Yes, Neil, would you want to comment on a lot of conversation has been, whether at CABRI or outside, on the strengthening of institutional capabilities, and that's all CABRI has been focusing on. And for you who have been also involved in the conversation post-Ebola, and from that experience coming into now, how do you see governments in Africa, and whether it's Ministry of Finance or outside the ministry, coping with having to deal with the COVID-19 pandemic, but that building on the existing weaknesses that exist in the system?
Okay, the countries in Africa are doing a lot of effort. We have seen there are two parallel efforts that are being done. Countries are strengthening the health system since the Ebola outbreak, and Africa CDC, for instance, is one of the immediate, let's say, results of the Ebola outbreak in West Africa. The idea was there in 2013. The head of state have decided in Abuja to establish Africa CDC, but the Ebola outbreak in West Africa was a kind of accelerator. It was a catalyst to accelerate and speed up the process of establishing the Africa CDC. So what we are seeing at continental level with this institution, countries are also establishing the National Public Health Institute to be able to cope with this kind of situation. And you cannot invest a lot of money. For instance, Sierra Leone and Liberia and Guinea, these three countries that have been badly hit by Ebola outbreak in 2014, 2016, they learned the lesson, for instance. And this is a concrete example. They have increased the allocation, the national budget allocation to health. It has increased, even if it has not reached the 15%. They have, you can see, year after year increase in the allocation. So, and across the continent, we are also seeing many countries establishing the National Public Health Institute to cope with this kind of situation that we are seeing here. So the result is the numbers that we are seeing not growing fast on the continent, because this is a lot of work has been done. Just after the Ebola outbreak, the WHO and a couple of partners have decided to go for what they call the joint external evaluations. The joint external evaluations is to assess the assess the core capacities of the international health regulations if the countries meet the core capacities. In Africa, we have seen that many countries are either red or yellow. Very few are green. And the result today is that all the countries that were green today are suffering. And we that we are red and the yellow, we know our limitations and we have taken measures to mitigate the impact of this kind of COVID-19. So the result that you are seeing today is not just out of blue. It is because some work is being done and profoundly done on the continent. Over.
Absolutely. Neil, from CABRI's perspective and institutional.
Very much. I think those are really great points. I mean, in terms of the health perspective, we have looked at Liberia in particular during the Ebola crisis, and just as a reminder, our 2016 CABRI conference looked at extraordinary budgetary pressures that countries face, and Ebola was one of those that we studied quite carefully. I mean, the whole idea of a lockdown and isolation is something that I think even at a WHO level, and also just how to respond to these types of pandemics, I mean, comes from the way that the three West African countries had tackled the Ebola outbreak. I mean, one of the first decisions taken was to have lockdown and the isolation. From an institutional capability perspective, I think this idea of improved coordination between the Ministry of Finance and the Ministry of Health is an important lesson. We certainly saw that in Liberia with the Ebola outbreak, where senior officials that were working more directly on the financing of the response moved into the offices of the Ministry of Health to improve on the coordination. And that is, I mean, one that we certainly come across a lot in building institutional capabilities. The setting up of trust funds was something that Liberia did during the Ebola outbreak for development partners, private individuals, private sector to contribute funding. We have on our COVID-19 page in our website a study on lessons learned, especially from the financing perspective on Liberia's response to the Ebola crisis. And then, as you said, Ajvina, there's also fairly extensive work on building capabilities. Let me just say, maybe in conclusion, the issue of health financing. I think that that many studies that have been undertaken, and I think there's some common ground between finance ministries and health ministries, and I suppose, I mean, the countries as governments as a whole, is this point of underinvestment in health. And it is a crisis that in a very, I suppose, stark way reveals the underinvestment or the weaknesses that result from the underinvestment in health. We did see a tick up in terms of the increased investments in health in the countries that were affected by Ebola, but looking at the budget data across African countries, there's a lot that can be improved in terms of investment in health. Thank you.
No, absolutely. I think this is also a lot of the conversation in the chat box as to whether the post-COVID-19 era will actually prove or show to governments that there is an urgency to increase their health budget. But let me go to the next question and address that to Mrs. Evelyn Arthur. A lot of questions are also pertaining to accountability mechanisms in countries. So one question in particular from Dr. Anastasia Kimio from Spark. So thank you, Dr. Kimio, for being online. It's a pleasure having you on the webinar. The question is as follows: please talk to accountability mechanisms in countries to ensure investments are used to mitigate challenges of COVID-19. So maybe we can start with Evelyn. You can tell us a little bit more how that's being tackled in Ghana.
Thank you very much. As I said, we'll continue to use the country systems to, already we have Ghana Integrated Financial Management Information Systems, and so which enables us to be able to track all expenditures that are made. And as I said, we also continue to use the procurement systems to make sure that contracts awarded, even if it's through the sole sourcing process, because it's an emergency, that is transparent, and so the ministry to be accountable for it. And we have also set up 2 committees. I mean, I explained that every expenditure that we make out of the fund has to go through the Ministry of Health. It has to be vetted by the Ministry of Health, and so before it's forwarded to the Ministry of Finance for release, we want to, the minister responsible for health will have to certify that if it's delivery of supplies, I mean, all of that has been supplied, and there's a source receipt advice to show that the goods have been supplied. And then when it comes to, then the internal auditor at the ministry has also gone through, make sure that all the procurement processes have been adhered to, and then the stores processes have also been adhered to. When it comes to Ministry of Finance, we also vet all of that before it's submitted to management for approval, and before the funds are released. We are going to also be publishing, reports. So one of the things will be to report on it. And then the other thing we've also done to also ensure that Parliament is well informed. And so if you look at all the number of funding sources, I mean, if it's a loan, or whether it's lowering the cap on the stabilization, whether we're going for the IMF rapid facility, we've gone to Parliament for those approvals to enable Parliament to also know what is happening and exercise the necessary oversight. So we're making sure that we are not just addressing it from the Ministry of Finance, but all the stakeholders that have to be part of the disbursement processes are brought on board. Yeah. Okay. Thank you.
Ashvina, can I come in? I think, thank you, Evelyn. I think those were really good measures that have been taken. I think the lesson for countries is also that these provisions have to be in place and have to be built into existing legislation. So many public finance management acts of countries have in their provisions, they cover how procurement happens when an emergency occurs. I mean, even the African Union has a separate emergency procurement legislation that would cover the way that procurement happens when the conflict breaks out, for instance. And the importance of that is that you don't have arbitrary decisions made, you don't have a random approach to the way that goods and services are going to be procured, but it is set out already in existing legislation, and this helps to ensure that there is that paper trail, that there is accountability that is going to be followed. Obviously with COVID-19, I mean, there's a unique aspect to it, and that is this lockdown where many institutions have been closed. So in South Africa, Parliament even works remotely, and you have to convene Parliament remotely. So it's not as straightforward in terms of these decisions that are taken by the executive that can then go to Parliament for Parliament's approval. But I think as we going to be exiting, especially the lockdown aspects of the measures that have been taken, that I think many countries would be advised to look at some of those emergency procurement mechanisms that they have in place and see how they've performed under the pandemic, how they performed under these emergency measures that have been put in place. And I would suspect that many countries would want to relook at some of those provisions. I think that many are saying that we can't approach this as if it's going to be a once in a lifetime event. These types of events may become more frequent, and we may find that even the more natural types of emergency as a result of climate change could become more frequent. So governments need to build up their capability. Governments need to build up their rules and regulations that allows for rapid deployment, rapid procurement in cases like we are experiencing right now. Thank you, Ejfina.
No, I think that's actually really summed up the different kind of way forward that ministries of finance should move forward. So I think it was really well put, Neil. We are almost at the end of our 1.5-hour webinar. It's been a lot of questions. So maybe just to wrap up and have closing comments from each one of you. I will just launch one of the questions from actually one of our colleagues at CABRI, who's basically putting the question forward of what are the weaknesses that the COVID-19 pandemic has specifically revealed in terms of the budget of health. And a few of you have already covered the broader framework, but what are the changes more specifically that, for example, every Ministry of Finance after this webinar should have on their radar to strengthen health financing in the medium term, not necessarily addressing the firefighting, but what's next so that we prevent this kind of situation in the future. So maybe we can do it in reverse order, starting with Evelyn, Dr. Djoudalbaye, and ending up with Neil.
Okay. Thank you very much. I think that this is an opportunity for Ghana to look at health sector financing, and the president of Ghana has already given the signal. It's been revealed that a greater number of our districts do not even have district hospitals. And so the president has committed that within the next 1 year, at least some effort should be made to make sure that all districts have district hospitals, so that in case of emergencies as this, they will be able to respond at the district level without having them to transport people who are sick from the district to the regions. Again, the president has also given an indication that we also need to look at having regional hospitals, because quite recently, Ghana has set up some additional 6 regions, and those regions do not have regional hospitals. So what it means is that if there's any, they have any serious situation like we are in currently, they might have to transport people. So obviously that is then now going to shift focus to make sure that we are now putting in more resources in the health sector. We are finding resources and putting in. So after COVID, and I think that what has also come out clearly is for us to also have centers for such communicable diseases. We need to strengthen that also in the health sector to be able to address that. So it's something that we are looking at going into the future. We don't have to wait till we have a pandemic of this nature before we start running around, but to be able to invest to make sure that we have the structures in place and the structures running. So I think that is something that Ministry of Finance is going to take up seriously, because it's coming from the very top. Thank you.
Thank you, Dr. Djoudalbaye. Please unmute yourself.
Sorry. I was saying that for me, there are key things. The first thing is the public health capabilities for Africa should be strengthened, with National Public Health Institute as the driver for the international health regulations implementation. That is the first thing. The second thing is a reward and penalty system should be implemented along with financial incentive to acknowledge whether progress has been made in implementing these core capacities or not. That is very important. The third thing for me is the implementation of the international health regulations, but they should be decentralized to the subnational level of the health services. That is very, very important. And the last thing for me is the governance, and especially governance, procedure governance for management of the public health data sharing should be established. Very, very important. Because today we can see the reproach that has been made to China. US saying that China did not share very quickly the information or whatever. I don't want to go to that space. But at our continental level here, what we want to see is the governance procedure for the management of public health data. That one is very important and is critical. So if we have that one in place, we can talk about a new public health order for Africa health security. Thank you.
Thank you, Neil.
Thank you, Ajvina. I've probably said enough, but just as concluding comments, I mean, clearly there needs to be improved investment in health. And the primary reason we need to do this is so that we improve the quality of healthcare in Africa and we improve access. I mean, the investment decisions taken by the President of Ghana to put in place facilities at a district level, I think starts to address this issue of improved access and also quality. But that is going to take significant financing. We're going to come out of this COVID-19 lockdown when we re-emerge and we open up our economies with budgets that are going to be very constrained. And I think we're going to have to start turning our attention to, you know, the more innovative ways in which we are able to finance health. In Ghana, there's a very good example in terms of the percentage of VAT that gets contributed towards a health fund. In South Africa is also looking at the implementation of a national health insurance, which I think is the correct decision that has been taken, including many other countries that are looking at different types of insurance mechanisms to improve on the investment in health, with the primary purpose of improving access and quality. And I think it is, once we start to address the overall improvement in the healthcare system with a focus on access and quality, that our health system is better able to respond to these types of crises. And I think that is one of the strong lessons that certainly will emerge once we start doing the post-mortem of the crisis and how different countries have tackled the crisis. This issue of what was the strength of the existing health system and to what degree did that assist a country to better respond to the crisis. Thank you, Ajvina.
No, absolutely. Thank you very much for all those insights. I think it's been a very engaging discussion on both fronts, not just from the perspective of the general population and the Ministry of Health, but also from us who work either within the Ministry of Finance or closely with. So we're now at the end of our webinar. I wish to thank all our speakers for being with us today and our participants for their very active contribution. Unfortunately, with time constraint, we could not address all your questions, but we will try to find a way to have these on our websites. A special thanks to my backup team for this event. We will try to also have the Cameroon presentation recorded and added and made available at a later stage on our website. So until we see you at our next webinar, stay safe, wash your hands and wear your face mask. Goodbye. Merci, à la prochaine.
Hi.
Merci.
Okay, goodbye. Thank you.
All right.